N-acetylcysteine is a cheap amino acid and antioxidant. It's one of the more effective and safer options to deal with the root cause of mental illness and suboptimal cognition. N-acetylcysteine is a modified form of the amino acid cysteine, and it helps your body to produce glutathione. Glutathione is a powerful antioxidant, and it supports liver detoxification and reduces free radicals in the body. Over the past 3 decades, high doses of N-acetylcysteine have been used in emergency rooms to combat acetaminophen toxicity. There's also an overwhelming amount of evidence showing the N-acetylcysteine can help to treat a number of neurological and psychiatric disorders, and to help with the recovery from mental illness and post-concussion syndrome. A systematic review of all the evidence suggests that N-acetylcysteine is effective for treating major depressive disorder, bipolar disorder, drug addiction, obsessive-compulsive disorder, autism, schizophrenia, Alzheimer's disease, and certain forms of epilepsy. N-acetylcysteine also reduces the severity of mild traumatic brain injury in soldiers, and animal studies show it can improve cognition after moderate traumatic brain injury. Disorders such as anxiety and attention deficit hyperactivity disorder, or ADHD, also have preliminary evidence. Overall, it's clear that N-acetylcysteine should be a first-line treatment for mental illness, along with other critical nutrients. The fact that N-acetylcysteine can improve so many different forms of mental health disorders, it tells us it's much closer to treating the root cause of these brain afflictions than standard psychiatric care. You can take 1500 milligrams of N-acetylcysteine every day to help to manage long-term mental illness. You might experience a side effect of heavy metal redistribution if you haven't detoxified yet, for example, by having your mercury, dental, amalgam fillings removed. You might find you don't need to take nearly as much after doing other integrative treatments. Some studies show people benefit from taking anywhere from 500 to 3000 milligrams per day. It can work better when taken with selenium and glycine, as these are also required for the glutathione synthesis. Typical doses are 200 micrograms of selenium per day, or 3 Brazil nuts. You can add 500 milligrams per day of glycine. However, many people take larger doses of this. You can check out my video on glycine for more information. It's important to note, N-acetylcysteine seems to target the biological pathways that are common across all mental disorders. And this is something mainstream medicine and the pharmaceutical industry would rather ignore. N-acetylcysteine isn't patentable. They'd rather focus on producing patentable, marketable new drugs for many different disorders. Some possible explanations for its effectiveness. The N-acetylcysteine has anti-inflammatory properties, and inflammation has been linked to depression and other mental health disorders. N-acetylcysteine has also shown to successfully cross the blood-brain barrier and to raise glutathione levels in the brain. Low levels of glutathione in the brain have been linked to a number of psychiatric disorders. High levels of oxidative stress have been identified in the brains of patients with a variety of psychiatric illnesses. Increasing the brain's glutathione by supplementing with the N-acetylcysteine can help to reduce this oxidative stress and protect the neurons from oxidative damage. The N-acetylcysteine might have beneficial effects on patients by reducing glutamate, a major excitatory neurotransmitter, and this can lead to overstimulation. If you're taking N-acetylcysteine, you're giving your body an efficient way to soak up the excessive glutamate. You're also reducing oxidative stress and inflammation by giving it glutathione. As a result, this can help to alleviate a number of different mental health problems. A randomized control trial examined 149 individuals with moderate depression. They received 2 grams of N-acetylcysteine or placebo. Before treatment, the estimated mean depression score was 19.7. At the end of 2 months, the score had decreased to 11.1. The individuals who'd received the N-acetyl cysteine witnessed improvements in functioning and quality of life. Another randomized control trial looked at 75 patients with bipolar disorder. 2 grams of N-acetyl cysteine or placebo was given for 6 months. At the end of the study, the group that received the N-acetyl cysteine saw a reduction in their depression and significant improvements in their global, social and occupational functioning. The improvements were rated as medium to high, and it was concluded that N-acetyl cysteine is a safe and effective augmentation strategy for depressive symptoms. Several other studies have examined the effects of N-acetyl cysteine on bipolar, including mania, and it's found 2 grams of N-acetyl cysteine per day significantly improves and even causes a full remission of both depressive and manic symptoms. It's important to note some of these studies lasted 6 months, and this is a very long time for randomized control trials. All the studies had beneficial effects and 0 side effects. This is very impressive, especially considering pharmaceutical companies have spent billions trying to find a cure for depression and bipolar disorder and don't have much to show for it. All of this research makes sense in the light of a meta-analysis that found patients with bipolar disorder had significantly higher levels of oxidative stress and glutamate in their brain. A number of mood-stabilizing medications aim to decrease glutamate, yet they come with numerous side effects. Certain antidepressants can deplete glutathione, and this can further increase the oxidative stress. The N-acetyl cysteine is definitely a better and healthier long-term option. Substance abuse and addiction is very costly, yet there's hardly any efficient treatment that can prevent a relapse. A lot of research is emerging that's demonstrating a link between oxidative stress and drug addiction and how the N-acetyl cysteine can manage it. In a small study, 13 people abstaining from cocaine were given 2.4 grams of N-acetyl cysteine or placebo over 2 days. The participants who received the N-acetyl cysteine witnessed a significant reduction in their withdrawal symptoms and their cravings for cocaine. Follow-up studies showed the N-acetyl cysteine reduced the desire and interest in cocaine. Smokers voluntarily reduce their cigarette use by around 25% after 2 weeks of supplementing with 2.4 grams of N-acetyl cysteine. It's not just drug addiction. N-acetyl cysteine shows promise for the treatment of gambling addiction. A randomized control trial with 27 pathological gamblers showed the gamblers who supplemented with the N-acetyl cysteine scored 60% lower on the obsessive-compulsive scale for pathological gambling. Not surprisingly, there's brain similarities among people who suffer from addiction and obsessive-compulsive disorder. Just like addiction, higher levels of oxidative stress and glutamate are found in people with OCD. The standard treatment for OCD is a combination of antidepressants and psychotherapy. But around 20% of patients don't get better with this combination, and many suffer from a variety of drug side effects. Since N-acetyl cysteine is cheap and widely available, it's clear it has significant advantages for patients. Autism is a touchy subject. Autism has many different causes and contributing factors. N-acetyl cysteine can likely improve some of the autistic symptoms. Multiple studies show that N-acetyl cysteine is well tolerated in the treatment for autistic individuals, and it can reduce their irritability. Research has found autistic individuals have higher levels of oxidative stress and lower levels of the antioxidant glutathione in their brain. This makes it likely that the N-acetyl cysteine can help them. There's also a lot of evidence suggesting too much glutamate in the brain contributes to autistic symptoms. Glutamate is a major excitatory neurotransmitter. It's also a precursor to GABA, a calming neurotransmitter that reduces anxiety. There's an enzyme that converts glutamate to GABA, and researchers have found this enzyme is lower in individuals on the autism spectrum. This leads to more glutamate and less GABA, and therefore more excitation. Not surprisingly, glutamate agonists like N-acetyl cysteine have been shown to reduce the symptoms of autism, bringing them more into balance. Since oxidation and glutamate are abnormally elevated in patients with autism, the N-acetyl cysteine can kill two birds with one stone by providing an antioxidant effect and reducing the glutamate toxicity levels in the brain of the autistic individuals. There's a good amount of research suggesting N-acetyl cysteine can help with schizophrenia. Researchers gave 2 grams of N-acetyl cysteine to schizophrenic patients during a 6-month randomized control trial. The participants who received the N-acetyl cysteine experienced improvements in their symptoms, and many of them didn't experience improvements from other treatments. They demonstrated improvements in insight, self-care, social interaction, motivation, and stabilization of mood. Follow-up studies found similar results. One study explored N-acetyl cysteine's ability to change schizophrenic patients' EEGs. This is a measure of electrical activity within the brain. There was also a case report of a young woman who was treatment resistant, and they showed significant improvements in their schizophrenia by taking just 600 milligrams of N-acetyl cysteine every day. This makes sense considering there's an expanding body of evidence that suggests oxidative stress occurs in individuals with schizophrenia. Some research shows the more oxidative stress a schizophrenic patient has, the worse their symptoms get. And several studies indicate N-acetyl cysteine can benefit schizophrenics by increasing the glutathione and reducing the glutamate. Overall, oxidation and glutamate are often abnormally elevated in people with a wide range of neurological and psychiatric disorders. The N-acetyl cysteine may correct these underlying problems by generating the antioxidant glutathione and reducing the excitatory neurotransmitter glutamate. Patients who are suffering from depression, bipolar disorder, OCD, drug addiction, or autism should experiment by taking N-acetyl cysteine under supervision of a professional to see how it affects them. If they find it helps, they should keep taking it. Many of the studies also suggest N-acetyl cysteine enhances the effectiveness of psychiatric medication. Taking the amino acid leucine with N-acetyl cysteine prevents mercury from being reabsorbed into the central nervous system if you're using the N-acetyl cysteine for detoxification. You can check out my video on mercury amalgam detoxification for more information. To book a consultation or to learn about herbs, supplements, and natural treatments, check out my website.